Remember the old Gatorade commercials with Michael Jordan, who had beads of colored sweat of Gatorade drops, and he asked the all-important question, is it in you? In the same way, character matters, but is it really in you? Florence Nightingale, the founder of the modern era of nursing, recognized the importance of the character and the virtues of the professional nurse. To Nightingale, this was preeminent because caregivers during this era in the mid-1800s had little to no training. They were also women of ill repute. Many were alcoholics, prostitutes, and even sexual immorality was not uncommon on the patient care wards. Nightingale identified these virtues that were foundational to the professional nurse. Therefore, honestly reflect and determine if these values, the Fab Five, are truly in you. Number 1, truthfulness and honesty. Do you consistently tell the truth or only when it's convenient? Are you also willing to compromise truthfulness in order to cheat and to pass a test? Why is this important? Because the nurse who cuts corners by not being consistently truthful in school is going to be that same nurse in practice who will, if a mistake is made or something happens, is more likely to not acknowledge it and compromise the truth. Number 2, humility. Do you readily recognize your limitations as a student learner? Another essential question to reflect on is that, are you comfortable asking questions when you're not sure of what course of action to take in clinical practice? Why is this important? Because when nurses don't ask questions and are too prideful to acknowledge what they don't know, patients will be impacted adversely in that scenario. Number 4, integrity. Who are you really when nobody is watching? Are you the same person in private as you are in public? Many people wear masks, and they can look good to those that are out there, but in reality, there are areas of compromise and deceit that will ultimately impact patient care if that person isn't integrated. That is the root word of integrity. Are you integrated both in private and in public? It matters as a nurse. Virtue ethic number 4, compassion. Do you have within you that ability to suffer together with those that are hurting? As a nurse, you must be moved with some degree of empathy and compassion for those that you care for. And this is a foundational ethic that is central to the professional nurse. Number 5, respect. Do you have a high regard for the value, dignity, and worth of every human life, regardless of their ethnicity or socioeconomic status? And the lack of respect is the root of all incivility and bullying that is a cancer to our profession. If you'd like more on this essential topic of how a professional nurse must act and the values that they must possess, go straight to Chapter 4 of my student textbook, Think Like a Nurse. And Chapter 4 is how a professional acts. And there you'll find additional values, as well as need-to-know content that a nurse must know to critically think and clinically reason, and to think more like a nurse. Reflect and determine if you are struggling in any of these core virtue ethics of the nursing profession. It's never too late to get off the broad path that leads to destruction and choose the hard but narrow path by doing what is right. It is only then that you will demonstrate that you have what it takes to be a true healthcare professional and make a difference in all that you do in clinical practice.